It's a highly contagious virus that was practically eliminated in the U.S., but measles have returned, spreading at a record pace. Good afternoon, I'm Jeff Brady.
And I'm Deborah Knapp. We haven't seen any cases in San Antonio yet, but Eyewitness News reporter Aaron Wright joins us from a downtown hospital campus where concerns are growing. And Aaron, why are doctors and nurses so worried?
It's deeply troubling because they've seen it spread across Texas, popping up in major cities from Fort Worth to Plano to Houston and Austin. But the big concern is the harm it can do to people who aren't immunized against measles. Across the country and here in Texas, measles are making a comeback.
Since 2003, we have seen a 20-fold increase in the number of school-age children who are not receiving the recommended vaccines, and that amounts to just shy of 60,000 school-age children in Texas.
Dr. Van Ramshorst joins medical professionals across the country warning of how serious measles can be. According to the CDC, 1 in 4 people who get measles will be hospitalized, and the virus is extremely contagious.
9 out of 10 people that interact with that person are going to get measles if they're not protected.
Portland, Oregon is learning firsthand a state of emergency has been declared for a measles outbreak.
There are 23 cases of measles, which was declared eliminated from the United States in 2000. Most of those cases are children, and most of those cases involve people or children who were not completely immunized.
According to the CDC, the full course of measles vaccine is 97% effective. But Dr. Van Ramshorst understands parents have questions about the measles vaccine. He urges parents and caregivers to have the conversation with medical professionals, get their questions answered, and have their child vaccinated.
Immunizations are perhaps the most important thing that I can do for kids to keep them healthy and able to go to school and become healthy, productive citizens.
Now, here in Texas, there are 3 ways to be exempt from the measles vaccine. 1 being personal belief, number 2, religious belief, and number 3, already being under treatment for medical reasons, like someone getting treatment for leukemia. If you're having chemotherapy, getting the measles vaccine might not be the best idea. All of those things, certainly take the advice of a medical professional before not getting the vaccine. Medical professionals urging parents and children to make sure they go and get this vaccine. In downtown, Aaron Wright, KENS 5 Eyewitness News.
Aaron, thank you.